1 in 2 of us will receive a cancer diagnosis at some point in our lives. And yet most people know very little about how cancer actually works, how it starts, how it grows, why it so often gets found late, and what that means for their own health decisions. The gap between what the public understands about cancer and what the biology actually shows is one that costs lives. Not because people do not care, they absolutely do, but because they have never been given a clear picture of what is happening inside the body. Taking charge of your own health, recognizing symptoms that deserve attention, knowing when something warrants medical investigation. None of that is fully possible without that understanding. My name is Dr. Victor Hayes. This video is not intended to frighten you. It is intended to give you the understanding that I believe every adult should have, because it changes how you think about your own body in a way that genuinely matters. Let us start with what cancer actually is. Your body is made up of approximately 37 trillion cells. These cells are in a constant state of activity. They grow, divide, repair damage, die, and get replaced. This process is extraordinarily tightly regulated. There are signals telling cells when to divide and when to stop. Checkpoints verifying that a cell is healthy before it reproduces. Mechanisms identifying damaged cells and destroying them before they can cause problems. Cancer begins when that regulation breaks down. Specifically, when there is damage to DNA, the instructions set inside every cell governing how it behaves and when it divides. When DNA is damaged in the section that controls cell growth, the cell can lose its ability to respond to normal stop signals. It keeps dividing when it should stop. Each division produces 2 cells, each of which divides again. What starts as a single rogue cell can eventually become a mass of millions of abnormal cells. The important thing to understand is that DNA damage is not rare or extraordinary. It happens continuously throughout your life, as a normal consequence of aging, from environmental exposures, from viral infections, from the random copying errors that occur every time a cell divides. Your body produces approximately 4 million new cells every second. Even with extraordinarily accurate cellular machinery, errors happen. Most of the time, repair mechanisms identify and fix the mutation. If the damage is too extensive to repair, the cell is usually directed into a self-destruction process to prevent it reproducing. But sometimes that process fails. The mutation persists. The cell divides and passes the mutation to its daughter cells. If further mutations accumulate in the genes controlling growth rate or checkpoint enforcement, the cell progressively loses more of its regulatory control. It begins dividing faster than it should. It ignores signals to stop. A cluster of abnormal cells builds into what we call a primary tumor. Here is the timeline that should fundamentally change how you think about cancer. Research mapping the mutational sequences in colorectal cancer suggests it takes on average 10 to 15 years from the first initiating mutation to a clinically detectable tumor. 10 to 15 years of silent biology before anything becomes detectable. Cancer is almost always a very slow biological process, measured in years, not weeks or months. Now let us talk about why cancer so rarely causes symptoms in its early stages. This is the part that I think matters most for how people actually behave in relation to their health. Symptoms from cancer, pain, bleeding, a noticeable lump, are almost never a direct consequence of the cancer cells simply existing. They are consequences of what the cancer is physically doing to the surrounding tissue and structures. Until the tumor is large enough, or positioned correctly, to mechanically interfere with something, a tube, an organ, a nerve, a blood vessel, there may be genuinely nothing to feel. Most internal organs do not have pain receptors the way skin or muscle does. The liver can double in size from tumor involvement before causing any pain, because pain only develops when the outer capsule stretches. Early bowel cancer does not hurt because the tumor has not yet obstructed the bowel or reached nerve-containing tissue. Early lung cancer growing at the periphery of the lung, away from the airways, can cause no cough, no breathlessness, nothing, until it is large enough to affect breathing mechanics or until it spreads. On top of that, the body has a remarkable capacity to compensate. The kidneys can lose approximately 75% of their functional capacity before blood tests show abnormality. The brain can accommodate slow-growing tumors in some regions for surprisingly long periods because surrounding tissue adapts. This compensation is physiologically impressive and clinically deeply problematic. By the time compensatory mechanisms are overwhelmed and symptoms appear, the disease has often already progressed substantially. Sometimes there was genuinely nothing to notice, not because the person was not paying attention, but because the biology simply was not producing a signal detectable from the outside. Symptoms are not the beginning of cancer. They are the consequence of cancer having reached a point where it can no longer be silently accommodated by the body. When symptoms do appear, understanding what produces them helps you recognize patterns worth paying attention to. Obstruction produces symptoms when a tumor grows in or near a tube or passage. A bowel cancer causes changes in bowel habits or bleeding because the tumor is physically obstructing the bowel lumen. A tumor blocking the bile duct causes jaundice, that yellowing of the skin that brings people to emergency departments and which, when caused by pancreatic cancer, usually means the disease is already advanced. Bleeding occurs because tumors develop their own fragile blood supply. Bowel cancers bleed into the gut. Bladder cancers bleed into the urine. Lung cancers can cause blood in sputum. This bleeding is often intermittent, which is one of the primary reasons people convince themselves it is nothing. It happened once and then seemed to stop. But intermittent bleeding from a cancer is still bleeding from a cancer. If you have bleeding from anywhere in your body that is not a superficial cut, get it assessed. Pressure and invasion produce pain when the tumor grows into surrounding tissue that does carry pain signals: nerves, bone, organ capsules. Bone metastases cause pain because bone is richly supplied with nerve fibers. A brain tumor causes headaches not usually from the tumor itself, but from the raised pressure it creates inside a rigid, closed skull. Systemic effects: unexplained weight loss, profound fatigue, night sweats, reflect what cancer is doing to your body's broader physiology rather than to any specific local structure. These are less specific and have many non-cancer explanations, but when they persist without any other obvious cause, they warrant investigation. Let us briefly discuss how cancer spreads, because understanding this clarifies why early detection matters so much. Once a primary tumor is established, it can develop the capacity to spread. Cells break away, enter the bloodstream or lymphatic system, travel to other parts of the body, and if they successfully implant and begin dividing, they form secondary tumors. Different cancers have characteristic patterns of spread: prostate cancer preferentially to bone, bowel cancer first to the liver, breast cancer to bone, liver, lungs, and brain. Metastatic disease is so much harder to treat than localized disease because once cancer has seeded in multiple organs, local interventions cannot address the whole picture. Surgery can remove a primary tumor. Radiotherapy can target a specific region. But if cancer cells have spread throughout multiple organs, treatment must become systemic, affecting the whole body. The stage of diagnosis matters more than almost any other variable in determining what is possible. This is why screening exists, to find cancer before it produces symptoms at all. Colorectal screening programs detect tiny amounts of blood and stool that would never be visible to the naked eye. Cervical screening looks for abnormal cell changes caused by HPV before they progress to cervical cancer and has reduced cervical cancer rates by approximately 70% in countries where it is well established. A 70% reduction in a cancer that used to kill tens of thousands annually, achieved by finding abnormalities before they become cancer. Mammography, PSA testing, low-dose CT for high-risk lung cancer groups all exist because the biology of these cancers makes symptom-based detection inherently late. What does this mean practically? The framework I would offer is this: a symptom that is new, that represents a clear change from your personal normal baseline, and that persists for more than a couple of weeks without a clear explanation, warrants a medical appointment. Not because it is likely to be cancer. In most cases it will not be, but because it deserves proper assessment rather than ongoing self-monitoring. Specific things that should lower your threshold for prompt medical attention: unexplained weight loss of more than roughly 5% of your body weight over a few weeks, persistent unexplained bleeding from anywhere, urine, bowel, sputum, a new lump or swelling that does not resolve within a few weeks, persistent pain without a clear mechanical explanation that is not improving as expected, progressive symptoms, things not only persisting but actively worsening over time. None of these individually mean cancer. All of them mean you should be having a conversation with a doctor rather than a conversation with yourself about why it is probably nothing. I want to name 2 failure modes I see repeatedly because they pull in opposite directions but both cause harm. The first is health anxiety, reading a list of cancer symptoms, experiencing a brief bout of bloating after a difficult week, and concluding something serious is happening. Single short-lived symptoms in the absence of anything else are almost always benign. The biology I have described operates over months and years, not days. The second failure mode is avoidance. Normalizing persistent symptoms, attributing them to stress or getting older or something eaten, not wanting to make a fuss, deciding that if it were serious it would be more obvious. That is the failure mode that costs lives. That is the pattern I watch play out repeatedly. The person who has had something going on for 8 months and kept meaning to get it checked. The sensible position is between those 2 extremes. Attentive to changes that are real and persistent. Willing to act on them through a medical appointment without either catastrophizing or explaining them away. Cancer does not appear overnight. It develops through a process that typically takes years, sometimes decades, from the first initiating mutation to clinically advanced disease. It runs silently for most of that time, either because the tumor is genuinely too small to produce symptoms or because the body is compensating in ways that mask the damage. And then eventually something shifts. The tumor reaches a structure it can no longer avoid. The compensatory mechanisms are overwhelmed. Symptoms appear. By that point, the disease has usually been present for a very long time. That is not a reason to live in fear of your own body. It is a reason to take seriously the things that deserve to be taken seriously and to act on them promptly rather than filing them away for later. The gap between good outcomes and poor outcomes in cancer is not primarily a gap in available treatments. It is often a gap in the stage at which the disease is found. And that stage is something that your own decisions and attentiveness have a real influence over. Please subscribe to this channel and share this with someone who needs to hear it. I will see you in the next video.